Thanks, everyone. My name is Sandra Cavalieri, and I'm from the Climate and Clean Air Coalition Secretariat, hosted by the UN Environment Program. And it's my pleasure to welcome you to tonight's VitalTalks Live, Safer, Healthier Air Starts with Data. And this is hosted with my colleagues from Vital Strategies and the Environmental Defense Fund. And we really thank the Environmental Defense Fund for hosting us all tonight. So thank you. Now, so we all know that humanity is wrestling with the ubiquitous challenges posed by climate change, air pollution, and its extreme impacts on our health. And so while our collective challenge is very daunting, I think it's helpful to be optimistic. And I think that I see three reasons to be optimistic. So the first is that since the Climate and Clean Air Coalition was established in 2012, we finally have reached the point where our key messages on the multiple benefits from reducing short-lived climate pollutants are echoing around the world. It's not a new idea, like we are really hearing it from everywhere. And second, we have really strong partnerships, and we have extremely loud calls for enhanced cooperation and coordination around the world, especially at the regional level. And so a really exciting news is that in Africa, we are going to see the dawn of a new Africa Clean Air program, and this will be launched on September 7th for Clean Air Day. So that's something coming on the horizon, which I think everybody recognizes is long overdue. And so learning from the experiences of the Latin America and Caribbean region and the Asia region, we're really going to work together to strengthen the Africa Clean Air program. And third, governments are committing to act, and governments are requesting technical assistance. I think this is really new, where the door is open, and actually we just ran a call for proposals at the Climate and Clean Air Coalition, and we received about over 700 proposals, which was completely shocking. Last year, we received about 150. So the word is out, and we also have over 87 countries that are partners in the CCAC, and those countries are also making specific requests at the national level for specific support, which we want to encourage more requests related to clean air. So I'm going to encourage you all to keep in mind reasons that you are optimistic tonight while you're listening to the discussion. We are focusing tonight on policymakers, on health practitioners, and on citizens, and how they can use more and better data to scale up mitigation and to realize the immediate benefits for public health, for ecosystem health, and also to bend the curve to slow the rate of global warming. So tonight, we're really pleased to be able to show two short films, both telling the story from different perspectives, and both are exploring data-driven work to improve air quality at the intersection of climate and health. After the films, we'll be joined on stage by Sumi Mehta, Vice President of Environmental, Climate, and Urban Health at Vital Strategies, and also Sarah Vogel, Senior Vice President of Healthy Communities at the Environmental Defense Fund, for a smoke-free fireside chat. And here with us tonight is Rafael Peralta, my colleague and the director of the UNEP Regional Office for North America. And so I'm pleased to welcome you, Rafael, to the podium.
Thank you, Sandra. Hello, friends and colleagues. Pleasure to be here with all of you tonight. I'm new to this space, which is amazing. So thank you to the EDF for hosting us tonight. And thank you, of course, to Vital Voices for organizing this tonight. We at UNEP are pleased to host CCAC, the Climate and Clean Air Coalition, an acronym that I can never spell, but I think I got it right this time. They are, frankly, we think a pioneer example of how to do business in a different way and how to bring member states together with actors, activists, and partners. I have very long talking points that Sandra has prepared for me. I'm going to try not to bore you all, but I think when we talk about climate, about clean air, I think they tend to forget. We all hear these figures about how 1/3 of the world population is impacted by not having access to clean fuels and technology for cooking, how 6.7 million premature deaths are not or are a result of air pollution. The figure on the economic impact of 8.1 trillion. I actually like to think about it in a slightly different way and think, actually, every year we're having one COVID pandemic in terms of deaths that are happening. We're losing two Japans in terms of economic impacts. And this is, to me, it's a different way of looking at the reality of the impacts that we're seeing from air pollution. Obviously, air pollution data helps us grasp the realities of what we're facing. The hidden sources of pollution that CCAC is working on, and many of you, the ways in which it impacts our health, our economies, and the environment, of course. But also, I think, the way in which it can help us imagine a different, brighter future. Sort of how would the world look if the data was, with 5, I never know the figures, but 5, 2.5, or 5, whatever, or a much lower grade of impacts of PM 2.5, let's say. Back in February, 193 countries came to our Environment Assembly, the so-called UN Environment, or UNEA, which we try to call the Global Environment Parliament, or the Global Parliament for the Environment. And as parliaments sometimes do, they managed to agree on something. In this case, they managed to agree on a resolution to create new partnerships, a new global regional action on climate air. It's hard to imagine that member states, that some of which are literally fighting as they were negotiating, were able to agree on something like this. And yet the resolution went through, in part thanks to the good work of our colleague Alexandra. And today, that resolution is a demonstration of how partnerships have a tremendous power to promote regional cooperation, to turn the tide. We are seeing great examples, of course, of partnerships improving air quality around the world, and data being at the center of that, and examples like the Clean Air Catalyst at USAID and the global partnership of organizations led by the World Resources Institute and the Environment Defense Fund are leading. And this Clean Air Catalyst project by USAID and others is using novel data to impact approaches to tackle the root causes of clean air pollution in 3 cities, in Indore, India, in Jakarta, in Indonesia, and in my beloved Kenya, or Nairobi rather, the capital of Kenya, where I used to call home a few months ago. CCAC, as Sandra was saying, is unique. Frankly, I like to say that it's living proof of how multilateralism can deliver to address what we describe as the triple planetary crisis of climate change, the crisis of biodiversity loss, and the crisis of pollution and waste. And so with over 120 projects and supporting over 40 countries, CCAC shows the impressive track record of what we can achieve when we work together, bringing both commitment, means, and action. At the core of what they do is working in these nexus areas where there are co-benefits, obviously for health, for the air we breathe, and for climate change. And central to their efforts is what they've been doing on methane, which obviously has tremendous climate change impacts, and we've all heard about that, but obviously has also critical health nefarious effects. And I'm sure you've heard some of these figures, but methane itself, or cutting methane, could each year result in about 255,000 fewer premature deaths, could enable us to avoid related hospitalizations for up to 775,000 asthma patients. We could save 73 billion hours of lost labor from extreme heat and 26 million tons of crop losses globally. And the good news is that we have low-cost, feasible, practical solutions to cut emissions from the most dangerous short-lived climate pollutants, including reducing methane emissions by 40% and black carbon by up to 70% by 2030. And we have seen how strong science, such as the Global Methane Assessment, can drive political action, like we have seen with the Global Methane Pledge. And we're delighted that CCAC is now providing a secretariat to the Global Methane Pledge, and that they're also leading a support system to assist countries in taking action in this space. This year, unfortunately, we say every year is critical. I think it's critical for two reasons. On the one hand, I think we need to try to break the impasse of lack of funding for air pollution. It's always shocking to hear that only 1% of international development aid goes to the air we breathe, goes to the one thing that enables us to sustain our lives. And we also think that this year is critical because countries are working on their new plans under the Climate Change Convention, the international determined contributions that they have to submit to the UNFCCC COP. We all have to put our forces together to help countries raise ambition to address methane, black carbon, and HFCs in their NDCs, as well as to publish their methane roadmaps and get them financed to turn ambition into action. And we at UNEP and CCAC, under the Clean Air flagship program, we will be working together, as you heard Sandra mention a minute ago, to address the implementation of what we describe as this Africa Clean Air Program for Breathe Africa, and the development of the Air Quality Management Exchange Platform in response to the resolution that I mentioned a minute ago. So let me hand it over back to Sandra to introduce the films. Thank you.
Well, so thank you so much. It's really seriously a pleasure to be here and to be able to make these connections between CCAC and UNEP and also all the partners in the room, because it is true that it's kind of a miracle that the idea that the US and other countries had in 2012 actually brought us to this point. I think this first film that we're going to see is about cutting methane, which doesn't just slow warming, but it also improves health, because methane is a precursor of tropospheric ozone. And so when you are watching this video, it's explaining also how the EDF methane satellite is going to be able to measure methane like never before and provide a powerful means of accountability for communities and governments around the world. And this ties directly into the work of the Global Methane Pledge, which now over 155 countries have made this commitment to work together to reduce methane. It's not just any one organization or any one country. The World Bank also has methane for development, and there's just an overwhelming show of support for countries to make these changes in not only the oil and gas sector, but also agriculture and waste. So that's the first film. And then the second film is about air pollution in Jakarta, and it's actually just like a total tearjerker. I mean, it's really air pollution is a daily challenge for most people around the world. And we live in a very privileged place here in Washington, D.C., where we almost never have to consider the air we breathe. But I think really we all ended up in the role that we ended up in to really fight for people who are in a totally disadvantaged place. And so I think that we're really speaking for them, and we're really trying to figure out how we can solve the problem and actually collaborate with each other to make things faster to improve their air quality. So I really love the second video is very powerful. So with that, I think we should just watch them. Welcome, Sumi and Sarah, to the stage. We've just seen the two films that your organizations have developed with this shared mission of working at the intersection of air quality, health, and climate. And these two projects are really, one is focusing on the local, one is focusing on the global, but they're both with the same principle of that we can't act on what we don't measure or what we can measure. And so that's what we're here tonight, is to talk about data and data to action. So to start us out, Sarah, I'm going to ask you to say first, but you're both going to have the same question. I'd like to hear from each of you on some foundational questions. So The question really is about why. Like, why are you investing in data, and what kind of data is needed? I mean, if you go outside in Jakarta and every day you're confronted with this, well, Sarah, you're first. So if you see all of these, all of this infrastructure for oil and gas, like how do you, where do you stop between data and action, and sort of what factors led your teams to choose the approach that you took in the film?
Yeah. Well, so like you started, there's that adage that you can't manage what you don't measure, right? And so EDF's a science-based organization, and so we've always believed that we need to understand multiple pollutants, their sources, right, their impacts, as a key foundation to anything that you're going to do. I think most people know why methane, but and the good news is that that film was made, I guess, last year, and on March 4th, I think it was, we successfully launched MethaneSat. So it is already, as I heard this morning, has orbited the Earth more than 1,000 times.
Wow.
And MethaneSat was really designed for one single purpose, which was to be able to more quickly and effectively identify methane emission sources. And I think that's an interesting kind of model, where it was, we need data that's going to actually help us hold accountable to these commitments that we're seeing. So everything from the Global Methane Pledge to the oil and gas decarbonization charter, where you've got, I think it's 50 oil and gas companies that have committed to cutting their emissions and reducing flaring significantly. So now we have to hold people accountable, right? We've got regulations that are coming out. Well, how are we going to know if we're actually having an effect? And so that was the purpose. So MethaneSat will allow for the ability to detect large sources, but also small sources, be able to see not only sort of where the emissions are coming from, but who is emitting them, and how are those emissions changing over time? Again, to help in the tracking and measuring the accountability piece. But because this is about people's health too, we really wanted to try to ground the methane conversation also in what are the health impacts associated both with the near-term warming that's associated with methane, but as Daniel and Julia on the film were talking about, the air pollution that's associated both from tropospheric ozone, but also NO2 that's released from oil and gas emissions, and harmful VOCs that are really impactful to local communities. So part of that accountability case, if we call it action, is, we think, also making really visible those health impacts. And doing that, right, it's not the solution to everything, but you're expanding the table of people that are engaged in the conversation. These are the concerns of local communities, we know, by oil and gas producing facilities, that are going to need to be part of that accountability solution. And so for us, that's, a key part of it is really tying both, this is a critically important climate action, but it's about the public's health, and it's about delivering cleaner air.
Yeah, and just to say, I think that one of the most special things about MethaneSat is that all of the data is publicly available. And I think one of the things we want to avoid in the future is having private data that's only accessible to certain people, or even maybe that certain data is only accessible, and just having this public good is something that is really amazing that EDF has put together. And I also wanted to say that I know UNEP you work closely with UNEP's IMEO program, the International Methane Emissions Observatory. And I think that there's already examples coming out of when a country is notified, they are actually able to take action and then see the result in the second pass of the satellite. So it's really action, there is direct action that comes from seeing these plumes. So Sumi, in Jakarta, this is actually something that I wonder about, because when I have been in a place that has a lot of air pollution, obviously I feel really overwhelmed. I think it's an overwhelming feeling of where do you start? And so I'm really curious about all your experience in Jakarta, but also other places. But yeah.
Sure. And it's interesting because in some ways, the experience that we've had in Jakarta very much mirrors some of the comments that you made kind of at the global level with measurement. Because, at the end of the day, all of these issues are issues about people. It's not just about the data. It's not just about the statistics. Like, you can collect all the data in the world, but if nobody is using the data, it's not actually going to be meaningful. And so we're really trying to think very similarly again about data collection, data integration, and data use so that we can really use these data to raise awareness among the public, and then hopefully use that to also influence political will and really create focused action on where we need to get things really done. And I think, as you said, it's true. A lot of times we want to make sure that the data are publicly available, but that's not just about putting spreadsheets on the internet. It's really about making sure that the data are available, but also accessible and interpretable to people in a way that's helpful. Just saying, that we're going to tell everybody every day that, oh, look, today the air quality is bad. Yesterday the air quality was horrible. And tomorrow we think the air quality is also going to be bad is not really particularly helpful for anyone to be able to hear. But, what can we really do? And from Vital Strategies' perspective, especially as a global health organization, we're thinking about these really leading environmental determinants of health and thinking about how can we really use the role and really the key activities that are played by the health sector to be able to help to advance clean air action. And so this is where I think you saw in the video, really having the role of the frontline health workers being able to serve as really trusted advocates for clean air within the communities becomes really important. Again, to be able to raise awareness about the issue, also to be able to help provide guidance and information to families. Particularly we see, and I think as you see in the film, you'll see around the world in places that we worked, people, although air pollution affects everyone, right? I mean, it affects everyone across the life course, but people are really concerned about the health of their children. And so this is one way that we know is a very useful way of kind of engaging and getting people involved as well.
Yes. So that is going to lead me into my next question. And I do think this focusing on children's health is something that resonates worldwide. And like I was saying before, I think that we're hearing a lot of messages starting to echo. And you hear the same expressions if you're in like a disadvantaged community in a in Nairobi, and in the same next step, you hear the same conversation in the street of London. So I think that people are really caring about their kids and their health, and also adults, we should also be caring about our health too. So I think there's a growing recognition that the climate crisis is a health crisis. And as we saw last year with more than 140 countries signing the COP28 UAE Declaration on Climate and Health, it shows that we really need the health sector at the table when it comes to climate action. And air pollution is definitely one of the actual major pillars of what we need to be caring about. And so how are your organizations integrating climate and health? And what do you think is the most important way for the health sector to get involved with air quality? So maybe Sumi, if you want to go first and kind of pick up on the healthcare workers and kind of like how it goes through the system.
Sure. And I think, it's been really important. I think you often, a couple of years ago, you would have heard more pushback. I think things are evolving over time with people saying, air pollution, we know it's bad for the health, but this is really an issue that's of concern for the Ministry of Environment, for the environmental agencies or departments, depending on if it's at the national or the city level. But the same thing was said many years ago when you're thinking about other kind of other very important leading determinants of health, right? If you think about tobacco, if you think about road safety, if you think about other risk factors, there's a real critical component and role for the public health sector there that we can think about. And I think first and foremost, it has to do with making sure that we are using and finding ways to engage the health sector in the ways that make sense. So patient guidance, being able to raise awareness within communities, but also, as we discussed, making sure that we collect data on critical aspects of, kind of environmental determinants of health, for air pollution, not just the respiratory diseases, but also cardiovascular disease, which is really increasingly the leading the leading kind of health outcome that we worry about for people, how can we then start to collect these data in a way and also integrate that with data that we have on air quality in a way that really shows us what the impact is on communities, and increasingly also being able to use this to also really focus in on who are likely to be most vulnerable, and really thinking about this from an equity perspective as well, because we can use these data to start to really kind of hone in on, where are the places where people are experiencing higher levels of exposure, either because they are living in more proximity to high sources of pollution, right? Where are places where maybe the pollution levels are the same, but people actually don't have the economic means to be able to mitigate their exposure either through, air filters and things like this. And so even at the same level of pollution, people are not able to kind of protect themselves. Really thinking about how our cities are being planned as a result to make sure that whatever we're doing to improve air quality, we do it in a way where we can really kind of try to reduce those disparities, I think is very important and a role that the health sector can help to play.
Yeah, and on that note, I think there's also like a tremendous amount of cost savings that governments who have public health systems can save money when they take care of their patients before the problem. So I think those costs need to be calculated and like considered in this cost benefit analysis.
Absolutely. And I think now we're at a point where, it seems like we're too far along the road to say that we need to see only what the impact of air quality is on health and economics, but really moving more pragmatically to say, what are going to be the benefits of these actions that we can take?
Yeah. Yeah. And so, Sarah, from your perspective,
I can actually jump right in on that, because first I should just say that the work that Vital Strategy does with community health workers is so wonderful. And it's seeing that video again and watching that healthcare worker's name, I'm sorry, I'm forgetting, just the way she's talking about, you could really see all the training that she had had. It was really wonderful. So there's sort of three areas that we've been trying to do this integration of climate and health. And the first one really, again, being a science-based organization, is on that kind of technical side and just what you were talking about in terms of the quantification of the health impacts and the costs related. So to come back to the methane example again, and Nanya Roy's here who led this work, we, in the lead up to the development of U.S. federal regulations for methane, which were recently finalized for new and existing oil and gas facilities, we looked at what are the health impacts of national emissions from the oil and gas sector, and came up with a whopping $77 billion of annualized healthcare costs, and that was due to early deaths, respiratory diseases, and a large part of it being driven by NO2. That kind of assessment was also kind of fit for purpose, right? It was trying to focus in on the regulatory structure, thinking about, those arguments for how do you actually support a strengthened rule, and obviously what will come, which is going to be a lot of challenges to that rule. So we're trying to think about how do we build on that tool and do more policy scenario assessment. So you're looking at the benefits of reductions, whether it's in the transportation sector or oil and gas methane, and obviously many other sectors could be applied as well. That requires the integration of a lot of health data. So that's where that kind of bottom up into these models is really powerful. The second area that we've been working in is trying to change the conversation, like many have, and you guys both have been trying to do this around climate and health. And so we our foray in, because EDF was all about methane all the time, was to bring health there. And we started back at COP27 to really start this conversation and try to amplify it, and held a number of dialogues among different stakeholders in the major sectors of methane emissions to think about what are the possibilities for really promoting health through different strategies for methane mitigation. So again, it's bringing the public health folks to the table. People who literally, it's old silo breaking, but it really, that it really needs to happen. And then doing that also at the local level. And we're doing that now in Mexico. Again, it's an example on methane, where we're bringing kind of public health officials, scientists who understand where is the available health data, community leaders who are thinking about what are the health concerns, like what are the outcomes that would actually move the politics, and could we develop kind of a research landscape on that? So it's a very kind of collaborative. Let's bring everybody together to figure out what's the data that we need to drive action, what's available. And then just quickly, third is really in the policy space, and this gets at your equity point, which is we've been, and this is domestic example, using, data that's showing air quality, health impacts, the underlying sensitive populations to policymakers to help them think about how do you design a more equitable policy or intervention. So, for example, around things like deployment of heavy-duty electric vehicles in areas where not only do you have high levels of pollution, but you also have very sensitive populations, so that when you're actually putting in your infrastructure, when you're putting in those trucks, you're having a hopefully more equitable outcome. And how do you take those types of approaches where you're integrating all that data to try to design policy in a more equitable way? So,
yeah, I love that. There's a film called Asthma Alley that many of you may have seen a few years ago, where it was actually really shocking. I watched it with the American Lung Association, and they had a panel of doctors afterwards. And the number of children that are dying of asthma in the Bronx of New York, on such a regular basis, kids are dying. And I never really have heard anyone say, oh, we should target electric heavy-duty vehicles in the Bronx on those roads in particular. That's where we should have the infrastructure. But that is clearly where we should have the infrastructure.
Yeah.
That is such a horrifying reality that is never in the news, and it's completely shocking that kids would have to be living like this in New York City.
And there are great groups doing work there, and we've done some data visualizations with them, and also some visualizations about and assessments about, just as a total aside, the number of warehouses at a state level, and what's the demographic characterization and pollution characterization around these warehouses, which are just truck magnets. And in New York City, it's 1 in 3 people live within a half a mile of these mega warehouses, and that area in the South Bronx is incredible, right? Because you've got multiple highways, multiple bridges, you have these big facilities. But just a shout out, there's a great group called South Bronx Unite that's doing amazing work to try to do that kind of clean energy investment in their community.
Well, that's amazing. So in both of these films, we see that an important first step is being taken to shed light on the problem, like putting the satellite into orbit, installing the air quality sensors. But as we know, data doesn't always guarantee action. And so the question to both of you is that data alone doesn't make change, and people make change. And so how have you identified what's needed to drive this impact and action on the ground? I mean, you've both sort of touched on it, but if there's anything more you want to add on those points.
I think, one thing that we have to remember, it's really great in a way to kind of connect a lot of the global momentum, the national level clean air action planning process that are happening with actually what's happening now. Increasingly, we're seeing cities as agents of change, and really being able to think about how this really affects directly communities. How can we really use the data to really redirect many times public awareness, so that people are not just focusing on something which is kind of a little bit vague and hard to wrap their head around with respect to air pollution and climate, but really thinking about, what are those leading sources of kind of pollution that it's affecting climate in the long term, but how is this affecting us now? What are the leading sources that we really need to focus on? Who are they affecting? How can we really use this to focus more so that they get kind of targeted so that even the political will to actually act also increases. And then trying to think about, what you can do to really chip away at those things in the short term. But I think that we've seen amazing examples now of, cities really becoming, using, and always by the way, always using data, and most effectively, many times also integrating that use of health data to be able to connect and say, look, this is why this is a challenge that we're facing. We need to change the trajectory. We need to figure out what we're doing as a city, and we need to do it in a way that we can actually have measurable impacts. So, I think we're talking mainly about Jakarta here. There are many other cities where you've seen examples of the health sector getting engaged in different ways. There's a nice little website that the Clean Air Fund helped us to set up, actually in preparation for COP, but again, connecting the kind of global advocacy efforts with what's happening on the ground. So if anybody wants to have a look at that, we can also share the link for the website too. It's cleanairforhealth.org. And you can actually see examples of not just Jakarta, but what do they do in Beijing to really focus on air quality actions that improved air quality, where they could actually see measurable benefits. What are they doing in Accra? What are they doing in Kampala? What are they doing in cities really, Barranquilla, around the world, to be able to really see the change that can be impacted. And again, as you're saying, using data, but also using it in a way to really demand that the leadership of the community actually takes action.
Yeah, so I think that is really excellent, like this thinking of like step by step, and what do you actually have to do, and thinking of the air quality manager or the public health official. They're getting to their desk, they're sitting down, they're doing what they have to do, but like how do they take it to the next level? And this is something that we're really trying to create a one UN voice around an air quality management guidance platform. It's going to be called AQMX, and we're hoping to kind of like bring everyone along with us and share these best practices, but also your guidance that you guys as organizations are giving out now, and kind of like combine your guidance with, guidance from WRI, guidance from WHO, guidance from UNECE, guidance from UNFCCC, guidance from PAHO. Like, let's find a way that we can really all work together. I think that's the only place we're at, is honestly is figuring out how we can work better together.
Nice to add. Yeah. It's really interesting because when we've done a lot of these projects to measure and monitor air quality at a pretty local scale. And for years, the first question that cities and communities would come to us with is like, what sensor should I buy?
Yeah, that's going to be in this website. This is going to be in the platform.
Would flip it back and say, well, what's the question you're trying to ask? So this gets at the action part. So, I mean, just like data and information is necessary but insufficient, we know the same is true with policies. I mean, you could have policies on paper that are as valuable as the paper that they're written on, or the computer screen or whatever, So we've been playing with this kind of continuum of the data to action continuum. Really, it's not linear. I would say EDF's evolution has been really trying to figure that out in real time. And I think there's like 5 big components to it, which is you need the data. Right? And what's the data that you need is going to change, right? Is it multi-pollutants? It is a single methane satellite. It is the health impacts, the underlying population. You need the capacity to use it, right? You need to digest it. You need to be able to understand it. You need people who can work that data. And you need some kind of policy mechanism that's either a pull for that information, right? So it's like it sees the value of that. So you're asking the questions, and again, this is a very dynamic situation. Then, of course, you need resources. You always need resources. That's kind of creating this whole cycle. It's maintaining your information network, and then really the hardest, like most mercurial one, right, is you need political and public support. And one of the things, and this comes back to the important point you raised at the beginning, Sandra, which is transparency and public availability. And that's right. really key. So the Clean Air Catalyst program that Rafael, I think you mentioned at the beginning that Vital Strategies and EDF are a part of, that's co-led with WRI. At the kind of core principle of the project in these 3 cities is to build this shared understanding of the pollution and its sources so that you can start building these shared solutions. So the idea that you have to have a collaborative approach, right? It has to be inclusive. And that's really hard to do right now when you have deep divisions. And that's why the work of CCAC is so incredible during this divisive time, that people can come around the same source of information and understand it and argue over it, and then really understand, like, where are the problems, and then how do we create those solutions, and then can we track to see if we're having progress. It's about like fundamental accountability at the end. But that's I think building the trust and transparency is as important as putting satellites in space. Like, absolutely, right? So
yeah, and I think we're going to turn it over to the audience questions in a minute, but I would say part of what we're trying to do with the CCAC Clean Air flagship is part of it is a clean air finance sprint. And we're trying to copy the model of methane. So methane, I think the science just became more and more and more evident from 2012 to where we are today. In the beginning, it was black carbon that was thought as second to CO2, but methane actually is a really critical pollutant that we need to tackle to slow the rate of warming. But basically, I just totally lost my train of thought, but I was just going to say about money. Yeah, money. So the reason that methane really took off was because I think most U.S.-based philanthropies really got behind this idea that change was possible and put a significant amount of money on the table without even knowing where that money was going to go. And so for a few months, it was sort of like, okay, well, now there's this $350 million. What's going to happen? And then they created the Global Methane Hub, which has been amazing and really has gone from small projects to big projects to really encouraging the World Bank. Like, I think has really touched the world with methane. And I think that's what we want to see for clean air. And I would just say, like, my plea would be for those same organizations to sit around and say, okay, we have a double chance of hitting clean air and methane at the same time, and we can spark a revolution around clean air to really help in these places where it's super overwhelming, but also help in, if in the United States there's a $77 billion healthcare problem because of this infrastructure that could be just capped with stuff, then we should do that. So I think that's like my plea to the U.S.-based philanthropies who are listening. I think this is the next big thing, and we can all work together to rally behind this kind of funding. But anyway, I'm going to turn it over to the audience, and I think we're just on time.
Yeah. We're available for any questions. For any questions that you may have for our speakers. Yeah.
You were talking about.
No, I don't think it's on, but
Yeah. No, I think it is.
It's on now. Okay. So you were talking now about the funding, and I'm always intrigued by how come so little money goes into this problem. It's clearly, you were mentioning the 77 billion impacts, and
yeah,
it's mind blowing that it's no more money is flowing in. And so how do you explain that?
Yeah. Well, I'll explain it from the NGO perspective that I've seen is that, there was a lot of money in clean air for a while, and, back in the day, and a lot of those experts and a lot of those resources moved into climate as that became really the dominant environmental issue. And maybe this is okay to say, I think I attribute that somewhat to the success in kind of Western Europe and the US, right? We saw these incredible declines in air quality. I mean, from the passage of the Clean Air Act to, today, can't remember. I mean, it's dramatic, right? We've seen incredible improvements. And so I think that was a little bit in philanthropy does. It's like, well, we fixed that problem, right? And then climate was the big issue. And, our organization, because we kind of came up around the Clean Air Act in the United States, have approached a lot of problems through a multi-pollutant lens, even if we're just then now talking about climate. But I think that somehow that has gotten lost, this notion that we need to think about these things all as they're interacting. We know that there are aerosols that are coolants and that are warmer. It's one big atmosphere. So it's I think it's a little bit of wanting to have single bullet solutions, right? Getting very siloed and sectoral kind of solutions, just going after CO2. I mean, this was an issue in trying to bring out short-lived climate pollutants, right? It's just CO2. We're just thinking about CO2 and just, overly simplifying, quite frankly, the issues. And then also thinking that the problem's solved, and then watching these global air quality just go in the wrong direction. And then I'll just say one last thing that I've, because I thought about all of this and thought about this a lot, but the ability to actually see how bad the air quality is globally is actually kind of new, right? I mean, it's in a way, it's like, and VitalTalks may disagree, it feels like it's the tobacco of our time. Like we didn't realize how bad it was until we had the ability to do these. We had satellites, right? We did global assessments, and you have the generation now kind of annually of these impacts. And then there's WHO like ringing the bell, like, you guys, this is a huge issue. And there's just sort of this flow, like, I think it's happening. I think you're right. This is the next big thing because it's so devastating. But so we have to be hopeful that it's changing because it's impacting so many people.
So I have a slightly different take on this, because I think in some ways, and it's really ironic in a way and great that we're talking about the work with the satellite data, because I think if you really look at a map and you look at where all of the kind of reference grade air quality monitors are around the world, you'll see this density of monitors really in the places, particularly initially in North America and Western Europe, where a lot of the actions and the focus have taken place. And so it's almost like where there have been a lot of data, people have really acted, people have really focused on this. Increasingly what we're seeing is that, even with very little reference grade monitoring data on the ground, with remote sensing data, you actually get a very big picture of knowing kind of where you already have enough data to start saying, you know what, there's a problem here. What can we do about it? And then, I think our challenge now is to really think strategically and collectively about how we can meet different geographies, particularly in sub-Saharan Africa. Lots of cities, lots of places with limited kind of reference grade monitors, but huge problems, huge impacts that we all kind of acknowledge. How can we really meet these places where they are with respect to data and capacity in a way to really kind of not have to wait before we're going to put reference grade monitors all over the place, and really start to build up and focus our actions using the data at the same time that we're strengthening the data systems to do this.
And I would also say something that Inger said, which is that this isn't the development pathway that has to be taken for every country. So countries don't need to go through this dirty period in order to come out on the other side and to look like the United States. Things are different now. There's clean energy. There's a way to leapfrog to a cleaner future much more quickly. And so, I think it behooves us to really think about solar mini grids and electric cooking. And if we were going to invest the same amount of money in electric cooking that the world might just be about to invest in LPG, we might get there much more quickly in a much more clean way for everyone. And so the question is I guess breaking it down and saying you need to invest in these things. You don't need to go through a dirty period in order to get to clean.
Well, and I think pragmatically too, for governments of rapidly developing places, you actually don't have to make sure that you can clean up your environment at the expense of economic development. And I think that is something that a lot of governments are worried about. We see so many examples that we can share. You can definitely work to improve your air quality for health, for climate benefits without having kind of a decrease in economic development, which of course is something which is a major priority. So,
Yeah.
no, there we go.
Well, thank you so much. This has been really, really informative. We're starting to see countries that are updating their NDCs, nationally determined contributions, incorporating short-lived climate pollutants into that. From the data that you guys are gathering, how can we make sure that gets in the hands of the right people to incorporate that into their updated NDCs?
Yeah. It's a good question. It's a question that I've been wrestling with. The Global Climate and Health Alliance had done a report that looked at all the countries' NDCs, right, to see if they had talked about the health impacts of their commitments. And everyone talks about how, and this will improve people's health, and then it stops there. It's just like literally qualitative statements. And so we've been trying to think, okay, what would success look like for one country, maybe in a couple of areas, to have actually outlined the health benefits of, a pathway that they're taking. Like, what is that next crank when they're gonna, look to see the progress that they're made, that they're actually able to track some of those health improvements? So I'm thinking about it from the health data side. I think it's a huge task, but I think we all need to figure out how to do this, because I'm wondering what happens now. Like, there's been an agreement that climate is a health crisis. We need to track and measure the impacts. We've got these NDCs. How are we going to get to marry that data, and then thus bring in the health ministers in a meaningful way, and what's their role in doing that? That was the first time they came to the COP, which was huge. But what I'd always heard is they were like, "This is not my jam. I've got other things going on," right? And so I don't know if you all have thoughts about what that next phase of engagement with health ministers and getting more refinement behind those NDC commitments.
Yeah. And I think it's really important, because the first step, of course, is just showing up, thinking about how it's important. I mean, that is a critical first step, and I think that we should definitely celebrate that. But I think being able to then also bring the health sector to the table to say, okay, how are we going to measure? And again, it gets back to the data, right? Okay, we're going to talk about these. What are the indicators that we're going to use? Who's going to be responsible for measuring them on a regular basis? And, how can we kind of, leverage resources so that we're not having to put out yet another kind of routine survey, but really piggyback onto what we have ongoing. And so, I think that there are certainly ways of thinking about this, but part of it is also thinking, particularly for kind of these environmental and climate health related issues, being able to overlay the health data onto some of the risk data, because this is a perfect example where things are coming from different, different ministries are going to have different mandates for reporting, and we have to figure out a way of, making sure that things can be kind of harmonized in the collection process so that we can pull them together.
Mm-hmm.
I think Colombia is one of the ones that has the best example, and they worked really closely with PAHO and also for many years integrating health in through AirQ Plus and maybe also VenMap, the EPA tool. And so these tools are available to countries. And then I think it's going to be about, someone realizes Colombia did it and they call Colombia and say, how did you do it? What did you do first? Who did you have? Who do we call? What should we do? And so that's what we're trying to do with this guidance platform. Is there's going to be a health impact assessment thing, but there's also going to be a guidance on sustainable development benefits, so that somebody figures out how they can look at a picture holistically with health, ecosystems, all the pieces, crop production, so that comes together.
And it's interesting because, ironically, also, if you look at the countries that have done the best, when you check some of these different scorecards, it's not necessarily the wealthiest countries who have done the best job of thinking about how to do this. So we all have a lot to learn from each other.
Mm-hmm. Yeah, definitely.
So, I think we have time for one more question, if there's anyone. And if not, okay, great. 2100, future thinking. What's the best scenario? What's the worst scenario?
You can go first.
So that's a great, it's a great question. I think the worst scenario in a way is if we see where we are as a result of too much complacency and not really taking this issue seriously. I think the best scenario is if we actually see really shifts. And again, to me, I think it's going to be really important if we also see changes, not just in the overall air quality levels, but also in the distribution of what we're seeing in terms of the exposures to air pollution, ways that people are able to also minimize their risk, and really then also hopefully having stronger systems to be able to then really start to measure and show what the benefits are. Again, to the people at the end of the day, all of these statistics that we talk about, there are people behind those statistics, and being able to, if we were to have a movie and a little film in 2100 showing, what it used to be like how we used to talk about the London smog and other things, like, my God, how horrible it used to be back then, and look at how far we've come now. To me, that would be really wonderful.
Yeah, I like to think that it looks like, right, we've come through this energy and food transition, right? What that looks like, you could run a zillion different scenarios, right? But obviously the renewables have gone way up, right? We probably still have little bits of oil and gas, and we have minimal input into agriculture in terms of fossil fuel use, and we probably have a different whole landscape of population dynamics, right? It's really that part of between the migration, the decline in fertility rates, it's really hard to know what is the actual composition of the global population going to look like. Not to mention that we could have a lot of conflict right between now and 2100. How are we going to say it? How do you say it? 2100 is how you even say it. But yeah, I've never put my brain that far out. So it's a good question. Yeah, I think those hopeful narratives are critical right now. They're really critical. Yeah.
And we are really coming so far. I think even within the world of the people who are trying to make a difference, even though there are still scarce resources and there's still reason for competition, I think competition is completely out and cooperation is totally in, and also sharing as much as possible. And so I hope I'm not too much of a Pollyanna, but I've been sitting in the same chair since 2012, and I can tell you it's totally, totally different. And I feel that every day, things happen where I'm wow, that's something that's never been said before. That's something that I've never had happen before. And it's always in the right direction. So I feel really hopeful about that. I guess just thank you so much to everyone for coming. And also hopefully, we have your name and your contact information, and hopefully we can continue to stay in touch, because the Clean Air Day, the International UN International Day of Clean Air for Blue Skies, is happening on September 7th. And this is a day it's the 5th anniversary of the day. The day was kind of happened really quicker than all other UN days, because Ban Ki-moon was actually the one who was supporting it going through the UN General Assembly. So we're really lucky to have the day, and we need to make the most of it every single time it comes around. And this year it's the 5th anniversary, and so we're pushing really hard. We have a lot more people on our side working on it now, and so we're going to be pushing people to really have events, celebrate the day, show what's happening in their space, and so I would look for that. I also hope that we'll be successful with this Clean Air Finance Sprint, and we'll be able to distribute more resources through the CCAC to NGO partners and country government partners to help scale up this work. And then I would say that, we're always looking for ways to connect what's happening on the ground with this high level political strength that we have in the CCAC. And so if you know of something that you think, why is no one doing this? You should just contact us and tell us. So we can work harder on that. So yeah, I think there's, a one UN Air is also my dream is to have a UN Air office and have all of us kind of convening through the UN to help more and more governments. But all in all, I'd say we're doing pretty good. So thank you, Sumi and Sarah, and thank you to EDF and Ali and Carlos and all the colleagues who have made this happen, and Cecile, and I hope I'm not forgetting anyone, but thank you all so much. Great. Yeah.